Measles have been a hot topic in recent weeks, with at least 15 states with reported cases across the country. Here to tell us a little bit about the signs, symptoms, and much more is Jamie Swift with Ballad Health. Thanks for joining us today.
Thanks for having me.
Well, first off, let's just get to the basics. What are the measles?
So measles is a virus. It's really extremely contagious, and that's, I think, what people know about measles. It's extremely contagious. It's airborne, and that's one of the concerns with measles. It can cause a lot of problems, but it's also a disease that we can prevent with vaccine.
And we'll get to that in just a minute, but you mentioned that it is spread very quickly. What are some things folks can do to make sure, that they don't get it?
Yeah, so the best way to prevent measles is that vaccine. And so vaccine, it protects you with the 2-dose series, 98% protection. And so that really measles spreads only in those people who are susceptible to it.
Do you have concern for an outbreak locally here around the region?
I think right now we still have good vaccine coverage. The concern happens when you have those individuals who are not old enough to get vaccine. That's when we start to see spread, or if vaccine coverage starts to drop. With travel the way it is, we know that we are one plane ride or one car ride away. And with cases active in the U.S., while there's no immediate threat right now in the Tri-Cities, if anybody is traveling, they're not protected, they could come back, and we certainly could see spread.
And we'll get to a little bit more about some misconceptions about the vaccine, but what are some signs and symptoms that people need to look out for?
Yeah, so I think people know about that classic rash, but really with measles, the first symptoms you're going to have, fever, just feeling really bad, cough, runny nose, red and watery eyes. The rash starts after those symptoms. The rash is very classic, and then it starts on the head and then works its way down to the trunk and the extremities. So it starts up and works its way down.
And again, with the vaccine, there are some folks, that maybe they got it a few years ago. How do you know that you're up to date and that the vaccine is protecting you?
There's a lot of caveats, so you really need to talk to your provider, check your history. And so we know that there was a time frame that the MMR, the measles vaccine wasn't quite as effective in the 60s. So if that's when you were vaccinated, you want to talk to your doctor. The 2-dose series became recommended in 1989. So if you've only had 1 dose, you might want to check with your provider and see if you need that second dose. If you were vaccinated after 1989, you've most likely had both doses.
Well, Jamie, thank you so much for joining us. Great information as always.